On this Thursday night, another giant leap. NASA's rover survives a harrowing descent and lands on Mars. What it's searching for and what it's paving the way for. Varying vaccine rollouts.
We just need the vaccines.
We don't have vaccines.
A patchwork of plans and priorities. The government's broken promises on clean water.
Are we supposed to live like this our whole lives?
Frustration on First Nations over a decades-long crisis. And unfriended. Facebook's face-off with Australia. What's Canada's plan to make tech giants pay for news content?
Global National with Donna Friesen.
Good evening and thanks for joining us. A new era of exploration on Mars has begun. NASA's Perseverance rover landed on the red planet today after a nail-biting descent.
Touchdown confirmed. Perseverance safely on the surface of Mars, ready to begin.
Relief and exhilaration at mission control after a 482 million kilometer journey. And at the moment of touchdown, this tweet: "I'm safe on Mars. Perseverance will get you anywhere." Within minutes, the first images of the landing site were beamed back to Earth. Those images are just the start of an epic quest to not only search for signs of ancient life on Mars, but to send samples of the planet back to Earth. There have been other missions to Mars, but none as sophisticated as this. Eric Sorensen has our top story tonight.
We have confirmation of entry interface.
A journey of 7 months came down to holding your breath for 7 minutes as Perseverance plunged through the Martian atmosphere at thousands of kilometers an hour, slowed by a parachute, and finally rockets to ease the 1-ton rover to the surface. The team on Earth could only wait for a signal.
Touchdown confirmed. Perseverance safely on the surface of Mars.
This is just an incredible mission because of the science and the technology. What an amazing team. To work through all the adversity that goes and all the challenges that go with landing a rover on Mars.
Perseverance landed at Jezero Crater. Why here? Because it was once a lake fed by a river that created a delta where deposits were once laid. Deposits that some 4 billion years later should still be there.
Deltas are great at preserving organic matter and other types of biosignatures.
Biosignatures means signs of life. Primitive life, but very real.
We are not looking for advanced life forms. We are looking, by analogy to what we find in the similar time on Earth, microbial life.
Perseverance will snoop around for years, a Canadian part of the team telling it what to do.
The rover picks up those commands, executes them, takes pictures, does analyses, and I'm going to help with using the instrument to analyze the composition of rocks and soils and help to interpret some of the data.
The rover will examine rocks and will drill several samples to be sealed and brought back to Earth in 10 years by future missions for scientists like Canadian Chris Hurd to study.
We'll be able to hopefully tell that a particular rock that we investigate with the rover could have, organic matter in it, but it's not until we get a sample of that back to labs on the Earth that we'll be able to say for sure that life was actually there.
If there was life on Mars, it tells us that maybe the conditions to create life are not necessarily all that unique. I feel like that's so important for putting humans in the context of the universe. We want to know if we're alone.
One other aim of the mission, to test new technologies for a different life form on Mars in about 15 years, when humans plan to visit the Red Planet. Eric Sorensen, Global News, Toronto.
In keeping with a tradition that dates back to the early space age, Perseverance has brought a few goodies to Mars. One is the Ingenuity helicopter, the first ever to fly on another planet. Perseverance is also carrying the names of 10.9 million people etched onto 3 small silicon chips. And there's a special shout out to healthcare workers, a commemorative plate symbolizing healing and medicine to honor those on the front lines of the pandemic. And on the front lines here in Canada, the spread of COVID-19 appears to be slowing down, but that could change quickly as more contagious new variants gain ground. 40 more variant cases were confirmed in Ontario today. There are now 359 confirmed cases in that province. Most are the B117 variant, first identified in the UK. The Ontario government says it's still deciding whether to delay easing restrictions in parts of the province. The top public health doctors in Toronto and Peel region have asked the province to keep the stay-at-home order in place until at least March 9th to help slow the spread of the variants. New Brunswick is changing its vaccine rollout plan to try to counter the threat from the new variants. The province's top doctor says in some cases the second dose will be delayed up to 90 days, so healthcare teams can get the first dose to as many people as possible.
We find ourselves in the eye of a perfect storm that could lead to new outbreaks. We really have to make sure that our citizens in New Brunswick that are the most at risk receive protection against the virus.
Canada's Public Health Agency says today vaccine deliveries are back on track, and it is optimistic Canada will hit and even exceed its previous target. According to a new federal forecast, there should be enough Moderna and Pfizer-BioNTech doses to fully vaccinate 14.5 million Canadians by the end of June. The previous estimate was 13 million people, and up to 24.5 million Canadians could be immunized by June if other vaccines are approved for use. Well, many of the premiers have complained about the slow vaccine delivery. As supply ramps up, the pressure is on them to have a vaccine strategy that is ready to roll. As Abigail Bimman reports, some provinces are better prepared than others.
Are provinces ready for mass vaccine rollout? It's a different picture right across the country. Newfoundland and Alberta have released zero details.
I frankly don't understand the huge rush because we haven't even really gotten into phase 1B yet. We don't have enough vaccines.
New Brunswick and Quebec detail who will be in the next priority groups, but don't offer much more.
I'm very anxious, and in the next few weeks, we'll try to start visiting the places where we'll have mass vaccination.
They're trying to hire people, and they look kind of desperate, to get those resources right now. So I'm a little bit worried.
Nova Scotia and Prince Edward Island are planning community vaccination clinics in March, but haven't said anything about April or beyond. Ontario aims to vaccinate 150,000 people a day at mass vaccination sites in the spring.
Public health units and public health physicians are developing plans on how to enact the larger plan at a local level.
Manitoba's goal, 20,000 a day by April 1st. Saskatchewan is ramping up staff for 230 clinics.
We do have the capacity, we just need the vaccines.
But Warren's Phase 2 start could be delayed as late as June. And BC is planning for 172 clinics in Phase 3.
We've got good people in place. We're ready to go. We don't have vaccines.
While many provinces talk about centralized booking systems online and by phone, most are prepping for a March launch.
I have not seen too many plans that are very concrete and detailed.
Logistics expert Mahesh Nagarajan says there's much to plan. Facilities, people, information systems, monitoring for things like allergic reactions. The nature of COVID-19 makes it all more complicated.
We need to be looking at social distancing. So it was not like the flu vaccine where we could line up easily.
Using pharmacists does seem to be a countrywide plan.
We think that we can comfortably administer at least at a bare minimum 1 million COVID shots a week, and probably closer to 2 to 3 million.
But like millions of Canadians, they're still waiting for specifics too. Abigail Bimman, Global News, Ottawa.
The federal government has tabled legislation to reform Canada's justice system. The bill would repeal mandatory minimum penalties, giving judges more leeway when sentencing for minor drug and gun-related offenses.
These penalties have been shown to contribute to the over-incarceration of Indigenous people, of Black people, and of marginalized Canadians. We are simply restoring the judge's ability to impose the sentence that fits the crime.
If passed, the legislation would also allow for greater use of conditional sentences, such as house arrest and addiction treatment for people who do not pose a threat to the public. Mandatory minimum penalties would remain in place for serious crimes. The federal government promised to eliminate all boil water advisories on First Nations in this country by next month. Dozens of communities do not have safe access to clean drinking water. A joint investigation by Global News, APTN, and the Institute for Investigative Journalism has uncovered allegations the government's own procurement policies may be part of the problem. Krista Hessey explains.
It's a detriment to health and a dehumanizing problem faced by many First Nations across the country. Lack of access to safe drinking water. Charla Munias is 23 years old and has never had access to clean drinking water at home.
Sometimes, I just feel like losing hope. What's the point? Are we supposed to live like this our whole lives? Is that what they expect of us?
The Trudeau government has pledged nearly $2 billion and made promises to solve the water crisis. So why is this still happening? A year-long joint investigation by Global News, APT and News, and the Institute for Investigative Journalism has uncovered allegations that systemic issues with Indigenous Services Canada's policies and a lack of oversight are a significant part of the problem. First Nations leaders and industry experts allege federal policies that require First Nations to work with the lowest bidders on infrastructure contracts has led to communities receiving shoddy work.
There's always issues with the bidding system. Rather than putting quality management first, it's lowest cost.
A spokesperson for Indigenous Services Canada said in a statement that the low bid policy follows industry standards. And there's another problem. Indigenous Services Canada does not keep track of contractors who have done poor quality work, meaning there's nothing to alert First Nations before awarding another contract to a company with past issues.
Doesn't matter how many billions and millions they spend on Indigenous projects, the underlying model remains broken and they don't seem to want to fix it.
We took these concerns to Indigenous Services Canada Minister Mark Miller and asked him if he would commit to tracking complaints about contractors going forward.
I'm keen to have as much data as possible, and if it's helpful in ensuring that that people aren't the subject of sharp practices.
Minister Miller has also agreed to investigate the business practices of contractors working in Northern Ontario communities. But as more promises are made, First Nations communities continue to wait for basic human rights, some now for decades.
Why? What does that say about our country?
Krista Hessey, Global News.
On the new reality, we take a deeper look at how outdated federal policies have allowed poor quality infrastructure work to persist. You can watch that this Saturday here on Global. While Texas freezes, the state senator flies off to Mexico. Why the power crisis was a disaster waiting to happen. The extreme cold in Texas is a lesson to the rest of the world. Climate change will make extreme cold and extreme heat events more common. Texas clearly was not prepared for extreme cold. The collapse of its power grid has caused a cascade of problems affecting heat, water, food, and medicine. And as Jackson Prosco reports, it didn't have to be this way.
After days without heat, Texans are coming home to heartbreak.
Our whole apartment!
Burst pipes. Water still undrinkable.
There's no dairy, no frozen vegetables.
While grocery stores run dry.
Pretty short on supplies, especially water right now.
The search for warmth has led to tragedy. Hundreds of cases of carbon monoxide poisoning and fires. This one killed 3 children and their grandmother. For this natural disaster, officials are facing blame for failing to protect the power grid from a situation just like this.
The warnings have been there for years, and Governor Abbott has done nothing. Before that, Governor Perry did nothing. This was a train wreck on the way to happening 10 years ago.
In 2011, another winter storm prompted urgent pleas from federal regulators for Texas to winterize its vulnerable power plants to keep them from failing. It didn't happen, in part because Texas operates on its own power grid, unconnected to the rest of the U.S. and out of reach of federal regulations.
Every source of power that the state of Texas has been compromised.
The decision kept electricity prices low, but has exacted an unimaginable cost. The state's electric grid came within minutes of total collapse that could have cut power for months.
I don't want to raise false hope and pretend that things are going to get meaningfully better very soon. Yeah?
5 days in the dark was enough to strip away the necessities of life. Getting life back to normal will take much longer. Jackson Prosco, Global News.
Bailing in the middle of a crisis is never a good look, and there are calls tonight for Texas Senator Ted Cruz to resign. He flew to Mexico while millions of people in his home state were suffering. Photos of Senator Cruz at Houston Airport and on an airplane rapidly spread on social media Wednesday night. So did the outrage. Today, Cruz was seen heading home, checking in for a flight at Cancun International Airport. In a statement, he didn't apologize. He said, "Our girls asked to take a trip with friends, wanting to be a good dad. I flew down with them last night, and I'm flying back this afternoon." The U.S. advises against all travel to Mexico because of COVID-19. What if the novel coronavirus is here to stay? Still ahead, an infectious diseases physician offers some hope. It is hard to see where the world will be 6 months or a year from now. One question that is being debated is whether we have to get used to the idea that the coronavirus is here to stay. In January, the journal Nature asked more than 100 immunologists, infectious disease researchers, and virologists whether they think the virus can be eradicated. 89% said no. They think it's very likely or likely to become an endemic virus, meaning it will continue to circulate in pockets of the global population for years to come. It is a big topic, of course, and Dr. Suman Chakrabarty is an infectious diseases physician at Mississauga Hospital. He's here to help walk us through this. Doctor, one epidemiologist in this survey said eradicating this virus from the world is a lot like trying to plan the construction of a stepping stone pathway to the moon. It's unrealistic. What is your view?
I agree with that. You know, a respiratory virus job is to basically go from person to person. It can happen when you have very little symptoms. It's very, very contagious in that sense. So it's not something that you can completely eliminate. But that said, it's going to change the way it actually is over the next several months and become something that's more like a circulating virus. Like we see with influenza, it tends to cause problems in the wintertime, but it's something that's not going to be the same type of bad pandemic spread that we're seeing right now.
Well, is that what it means when a disease is endemic as opposed to a pandemic? And how does that actually affect the population?
Yeah, when you have an endemic disease, it's something that's there at kind of a low level of transmission. And you might have some times where there are spikes in transmission, but it's not the same as it is right now where we have these massive spikes that can overwhelm hospital systems. It's more something that happens, you know, seasonally. And we deal with this every year when we deal with influenza. So it's something that we live with. You can do it for years, and you have a vaccine that can keep things even better under control. And I think that's what we expect to see in the next several years.
Yeah, well, I want to ask you about what role vaccines will play. They'll reduce the risk of infection, of course, but will they be game changers that will really allow economies to open up?
Absolutely. Obviously, it's part of the entire picture that we're having with our fight against the virus, but vaccines are a huge part of that. It takes severe disease and turns it into something that's mild or non-existent. And with that, you can have a lot of pressure taken off the hospitals. You're saving lives, you're saving morbidity, and all these types of things are our ticket out of the pandemic. I do expect that we might need boosters in the future, but to have another pandemic with this same virus is very unlikely. So things will largely get back to normal as 2021 rolls on.
So if the virus does become endemic and is going to be with us, what do we do? What do our lives look like from day to day?
Well, our lives would look, to be honest, the same. It's just that in the hospitals around the wintertime, December, January, this will be part of our respiratory virus panel that we'll look for when people come in with respiratory symptoms. We'll have to brace for it because there are times where there are a lot of patients with respiratory illness that require ventilation or hospital support. So we will look for that in the healthcare system. In the community, we don't have to really do all that much, just like you don't do right now. But again, the general things, washing your hands and that type of thing, it will still be very important.
You know, Australia and New Zealand are attempting to have zero COVID, and they lock down right now when even one case emerges. Is it possible that that could become the norm, that some countries will effectively eradicate it and only people who can prove they aren't infectious will be allowed to go there?
You know, I think that's possible, but unlikely, because at some point they have to open their borders. They have a very significant advantage to us being geographically isolated. And that's one of the reasons they were able to do this in terms of the COVID zero. But that said, that at some point in the future, they're going to be having COVID, but it's not going to be at a very high level. They can deal with it with vaccination. And any cases that come in the hospitals will be able to deal with it overall. So it'll be back largely to the same style of life that was pre-pandemic.
Well, that's a positive message. Dr. Suman Chakrabarty, thank you so much for your expertise.
Thanks so much for having me. Take care.
News blackout, what Facebook's battle with the Australian government could mean for Canada. When Australians checked Facebook for news this morning, they got nothing. The company is in an escalating dispute with the government, which has proposed a law that would result in internet giants, including Facebook and Google, paying media outlets for content used on their sites. And it's not the only country rethinking the rules about getting big tech to pay for news. Redmond Shannon explains.
Australians knew Facebook might do this, but it was still a shock.
From the early hours of this morning, the social media giant began shutting down Australian access to the pages of major news sites.
Facebook has even emptied Aussie news pages for all users worldwide.
People will just revolt against it. Like, honestly, especially the younger generation, there would just be chaos.
The Aussie anger stoked by Facebook also initially removing non-news pages, including charities and essential services.
This is an assault on a sovereign nation. It is an assault on people's freedom.
It's all happening because Australia wants social media sites to share some of their huge ad revenues with news outlets. Broadcasters and newspapers have seen ad income fall since the start of the internet era. Facebook argues it actually helps by driving traffic to news sites.
If we had actually talked to each other, we probably would be in a much better situation than we are today.
In contrast, Google has struck multi-million-dollar deals with some Australian news outlets.
So will the minister insist that Facebook pay what they owe in Canada now? That would be solidarity with the Australians.
Ottawa is considering a similar law to Australia's.
Just last week, Mr. Speaker, I was in conversation with France, Germany, Australia, Finland.
The consequences for how news is funded could be huge.
But it doesn't actually tackle the key issue, which is that the model we've largely had for journalism and largely for print newspapers is broken. That advertisers don't go to print newspapers nearly as much as they used to.
The federal government has already pledged $600 million to help some struggling news companies. Redmond Shannon, Global News.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is St. Albert Botanic Park in St. Albert, Alberta. There are beautiful spots all over this country. Please email yours to viewers@globalnational.com. Thanks for watching. Robin Gill will be here tomorrow, and I'm back on Saturday with the new reality. Take care of yourselves. Bye-bye.